Nurses, are you ready to take your skills to the next level and become an IV insertion pro? Whether you're a nursing student or a seasoned nurse, this step-by-step tutorial is your ultimate guide to mastering for insertion. Get ready to turn heads and earn those coveted A+ on your clinicals with our easy-to-follow approach. Let's dive in and get started. Before we begin, it's crucial to have all your supplies ready. This includes an IV catheter for tubing, a tourniquet, gauze pads, an alcohol wipe, a syringe, and a needle. Securely attach the 4 catheter to the 4 tubing before opening the sterile kit to reduce the risk of contamination. Now it's time to choose the right vein for insertion. Typically, the veins on the back of the hand or the arm are best for adults. For infants and children, the scalp or the foot may be better options. Consider using a vein finder if needed. Select an IV catheter size appropriate for the patient's age and vein size. Once you've identified a suitable vein and chosen the right catheter size, it's time to proceed with the insertion. But don't rush this step. Take your time to ensure proper technique and optimal patient outcomes. Remember, accuracy is key. With your supplies ready and your vein identified, it's time to start the procedure. Apply the tourniquet 4 inches above the chosen insertion site and leave it in place until the procedure is finished. Gently cleanse the area with an alcohol wipe, then use a gauze pad to dry it completely. Now take the sharp end of the catheter and hold it like a dart. Insert the catheter quickly at a 15 to 30 degree angle towards the vein. Advance the catheter until you feel the bevel slide into the vein. You should also see blood return in the catheter. If you encounter any resistance or do not see blood return, stop and reassess the situation. With the catheter now in place, it's time to secure it properly. Use the gauze pad to hold the catheter in place and apply tape to anchor it to the patient's skin. Do not use the tape to pull the catheter taut. Instead, route the 4 tubing over the patient's shoulder to help keep the catheter from being pulled out. Congratulations, you've successfully inserted an IV line. Now let's delve into some valuable tips to enhance your technique and prevent common errors. Using the right size catheter is crucial. An oversized catheter can cause vein damage and impede blood flow. On the other hand, using a catheter that is too small can lead to inaccurate medication administration and increased risk of air embolism. To choose the right size, consider the patient's age, vein size, and the specific requirements of the medication being infused. For instance, pediatric patients typically require smaller catheters than adults. Additionally, certain medications have size restrictions to ensure proper delivery. Always check the medications package, insert, or consult a healthcare professional for guidance. Remember, selecting the appropriate size catheter is essential for patient safety and treatment effectiveness. So choose wisely and confidently. Another common issue during insertion is accidentally hitting the patient with the needle. Ouch, nobody likes that. To prevent needle sticks, use the side of the needle to tap on the vein and gently retract before inserting the catheter. This helps to minimize discomfort for the patient. Additionally, use a sharp He-quality catheter to reduce the need for excessive force during insertion. By implementing these strategies, you'll not only enhance patient comfort, but also ensure a smoother insertion process. Infection control is paramount when performing any medical procedure, including insertion. To maintain sterility, wear gloves and use a sterile drape or kit. These measures help to prevent contamination of the site and reduce the risk of infection. Additionally, follow proper hand hygiene practices by washing your hands thoroughly before the procedure. These simple yet effective steps are crucial for safeguarding both the patient and yourself from potential infections. Remember, a clean and sterile environment is key to successful insertion. Starting an IV might seem daunting, but with practice and the right guidance, you'll be well on your way to becoming an expert. Remember to choose the appropriate supplies, select the correct vein and catheter size, use proper technique, secure the IV line correctly, and prioritize patient safety. And don't forget to watch our previous videos for more valuable tips. With each attempt, you'll refine your skills and boost your confidence. So practice makes perfect. Keep going, and you'll master insertion in no time. Good luck!